Today in Ethiopia, over 99% of people who fracture a hip are left untreated. None of them can ever walk again, and the majority die within months. In addition to those with fractures, hip arthritis disables over 100,000 Ethiopians, preventing them from walking any distance. Currently, only one hospital in the capital, Addis Ababa, performs hip replacement surgeries and has a 3,000-person waiting list. In 2021, American surgeon Dr. Gavin Button brought a scrub technician, a physical therapy assistant, and 13 suitcases of disposable sterile goods to a remote region of Ethiopia to begin a new hip replacement program and train local Ethiopian surgeons to perform the vitally needed surgeries. 120 implants purchased by the Ethiopia Health Aid Organization had been delivered before his arrival. On this initial trip, Dr. Button worked with and trained 5 Ethiopian surgeons and performed 10 full or half hip replacements in just 4 days. All of the patients made successful recoveries and are walking again. Some of these local surgeons had previous experience with the surgery, but in many cases had simply run out of implants. In the US, the cost of the hip implants alone is $3,000. In Ethiopia, the average per capita income is $2,300. A company in India, however, can manufacture high-quality implants and ship to Ethiopia for a fraction of that cost at roughly $600. This Indian company provided the implants at discounted cost and will continue to do so. Dr. Button and his colleagues will travel to Ethiopia on a quarterly basis to continue the educational process and tackle the most difficult cases. The one hospital in Ethiopia that performs these procedures charges $7,000. But the plan is to charge less than 25% of the rate at most for those who can afford it. And half hip replacements due to fracture will remain free of charge, as that surgery directly saves a life. No one should suffer the usually fatal effects of untreated hip fractures or the agony of severe hip osteoarthritis. With high-quality, affordable implants and ongoing medical training for local surgeons, Dr. Button's team aims not only to prevent thousands of unnecessary hip-related deaths in Ethiopia, but to also greatly improve the quality of life for those afflicted with fractured or untreated hip arthritis. Partial funding for these services is provided by the nonprofit Ethiopia Health Aid Organization. To find out how you can help, visit us at ethiopiahealthaid.org.